So time is brain. So it is very important to know the signs and symptoms of stroke. Be fast, the acronym which is well established for our communities to educate about the warning signs of stroke. In Be Fast, B stands for balance. If there is any trouble walking, difficulty with the gait or coordination. E stands for eyes. If there is any trouble seeing, loss of vision or double vision. F stands for face. If there is any facial asymmetry or facial droop on one or other side. A stands for arm. If there is any weakness, numbness in the arm or leg. S stands for speech. If there is any difficulty speaking or understanding anyone, or if there is any slurring of the speech. And T stands for time. That means time to react. Call 911 right away. Please do not wait to see if the symptoms aren't getting any better or to call your primary care. Get to the emergency room right away. So typically, strokes are very common in elderly age population. After the age of 55, the risk of stroke doubles down every 10 years. Although the risk of stroke is more common in the elderly, but the younger population can also be at very high risk if they have uncontrolled vascular risk factors. Now, what are the vascular risk factors? Hypertension, which is the high blood pressure. Diabetes mellitus, which is the high blood sugars. High cholesterol, which is hyperlipidemia. Smoking tobacco, heavy alcohol use, certain heart conditions such as atrial fibrillation, which is an irregular heart rate, use of any illicit drugs such as cocaine or methamphetamine. So these are the very common risk factors. If these risk factors are not treated or well controlled, the risk of having a stroke increases very tremendously. The good news is stroke is preventable. About 80% of the strokes can be prevented if we know the risk of strokes. What are the risks again? The hypertension, hyperlipidemia, diabetes, smoking tobacco, obesity, obstructive sleep apnea, certain heart conditions such as coronary artery disease or atrial fibrillation, heavy alcohol use. If we are able to treat these risk factors either by lifestyle modification or if the medications needed in those cases. So make sure you know your risk factors, make sure you see your primary care physician on a regular basis, make sure you do the blood work to check if these risk factors are in control. Typically for the treatment of the stroke, as far as the acute stroke is concerned, there are two acute stroke treatments available. One is IV TPA. It is a clot busting medication. If any patient who is having stroke symptoms and the last known well or the time of onset is less than 4.5 hours window, they can receive this medication if they come to the emergency room within the time window. They typically get the acute stroke evaluation and the brain imaging CAT scan to make sure they are eligible for this medication. The second therapy available is the minimally accessible surgical procedure called endovascular thrombectomy. If someone is having an acute stroke and has a clot in a brain, with this procedure we can go through the groin artery and reach the brain artery to get the clot out from the brain. And again, these patients can be eligible if they come within the 24-hour window or 24 hours from the time of onset of the strokes.